You're welcome back to the show. Many thanks for staying with us. Now, several stories of armed robbery have laced the headlines since January this year, with many of them being recorded in the northern part of Ghana. Inspector General of Police James Opombwenu is in the region as part of efforts to deal with the situation, which has even pushed tomato traders to go on strike after they alleged a number of their counterparts had been shot dead by armed robbers. Now, recent robbery attacks, specifically at Colibu, Katiu, Sandema, and parts of the Bongo district, as well as Bolgatanga, have left many of the citizens there living in fear, and some recently calling for the regional police commander to be transferred if, according to him, he was not up to the task. Inspector General of Police James Opombwenu has even had cause to send special anti-robbery teams there just last week to beef up police operations. Well, today, the IGP himself is in the region as part of efforts to clamp down on the high incidence of the robbery there. We'll be joined by our Upper East correspondent, Albert Sori, who is moving around with the IGP, or has been, and his team. But first, James Opombwenu has been interacting with his team on the ground, who are supposed to be dealing with the problem of armed robbery.
We have responded them. We return back to meet those who are also returning. It was after they are on the way going that we heard that something is happening here. They had blocked this road. And were robbing people. So when they received information and came, they were nowhere to be found. But the other one which happened was Friday. Sandema Chana Road is a twin road. Right goes straight into Chana Township. Yes, sir. The right goes straight into Chana Township, and the left goes beyond Chana, which is Colibu. So we receive information. It coincided with Fumisi Market. Chana have their market on Fridays, and then Fumisi rotate every 6 days. Yes, no, every 6 days. So on that day, it coincided with Fumisi, and the vehicle went to Fumisi, escorted the market, remained back. It was after they have escorted them back that they received the information that they were being robbed and proceeded to the place, but met no one there. So the one who was dead was rather on the twin road, the left one, that leads to K2. And it was after the day of incident that they found the body there. Initially, their thinking was an accident. So we moved to the scene. After we inspected the body, we saw a gun. Yes, sir. Yes, sir. So we went there, picked the body, and sent to the hospital. Postmortem is yet to be done. How did you know it was? So we got to know we found a pellet, an empty shell of AK.
As the IGP interacting with his team, who are supposed to be dealing with that problem on the ground, Albert Sori is joining me. He's our correspondent for the Upper East region. Albert, tell us what the IGP has been doing exactly.
Yes, Gifty. So what the IGP has been doing is basically, as you saw in that video there, go with the regional police command to the various places where these attacks took place. So that video was of the IGP interacting with officials of the Upper East Regional Police Command, who were explaining to him how the robbery incident took place on the Sandema Chana Road, specifically around the community of Katiu, where robbers had blocked the road last week and were robbing people who had been returning from the market. We are even learning that some women were allegedly raped. This is yet to be confirmed. But these are some of the stories that are emerging. So basically, the IGP has been going to these places to see for himself why these robberies were taking place and maybe what could be the reason. So he was at the Sandema Chana Road, and then the Kusunamongo stretch of the Colibu Road, where that tomato truck was robbed, and a driver who had been carrying tomato and another driver who was carrying cement were killed. He also visited that area as well. So he's basically been trying to see for himself how serious the robbery and the attacks on road users in the Upper East region has been.
And on the back of that, has he been saying anything? What has he been saying?
Yes, so he ended his tour at Kusinamongo, where he took the opportunity to interact with the media. He was very brief, basically just telling us why he was here, to see for himself how the situation was and to see what further support could be given to the regional police command as they intensify the operations to clamp down on these robbers. Remember last week, we told that special anti-robbery teams had come in and they are helping with patrols on the major highways where these tomato traders ply. So you talk about the Bolga Tamale Highway, as well as the Bolga Navrongo Highway and the Navrongo Paga Highway as well. They are doing patrols there. And some of the anti-robbery teams are also in some communities gathering intelligence as well. So basically, the IGP has been saying that he's come to see for himself how the operation is going and to know what further support can be given to the regional police command. So after the tour, he's going to sit with them for meetings and for discussions, and then whatever they need will be provided for the robbery attacks to be clamped down on.
Prior to his arrival in the region, Albert, the people had their concerns about the efficiency of the police command in the region when it comes to dealing with these robbery cases. How have they, how are they evaluating the visit by the IGP, if they've spoken to you at all?
Yes. So one of the concerns that people, they were actually saying it out of anger, especially after that tomato truck driver was killed. His body was taken to the Bolgatanga mortuary, Bolgatanga Hospital mortuary, and some of his colleagues went there in some demonstration style, sort of. So it created a bit of, a scene, and people gathered at the place. So it was during this time when we were talking to residents that some of them said that, all these things are happening. Remember, apart from these robberies that we have talked about, we have had incidents where people in Bolgatanga, the capital itself, motorbikes have been snatched. Some man who is selling building materials was robbed not less than 2 weeks ago. He was attacked while driving his car. He was ordered to stop, brought out of his car, and he was robbed. So people were beginning to feel that they didn't understand why all these things are happening, and there appears not to be anything, done about it. So these were just the concerns they were sharing, that if the commander was not doing enough, then it was high time someone else was brought in. But over the last few weeks, it appears that when they started seeing more of police presence on the roads, in fact, this afternoon while we were on tour, we actually saw a police patrol truck, a police patrol vehicle escorting a tomato truck on the Navrongo highway. So people are beginning to see the work that the police are doing, and they are coming down a little bit more. But prior to this, the concerns and the anger you could tell that people were not happy at all.
Well, Albert, the IGP has been speaking, and you brought us a clip of that. Let's take a listen to that, and I'll come back to you. Then we wrap up on that part of the conversation.
That they have put some measures in place to stem the tide or to prevent the robberies and other crimes from occurring. I will sit down with them again, and then we'll review those plans, and then we'll see what assistance we can give them to ensure that the crimes do not occur again. I can assure the general public that we're doing whatever we can, and we'll go to whatever length to ensure that the public is made safe.
Also a rather brief one, but Albert, has he finished with his tour?
Yes, he has finished with the tour. What was left for him to do was to have private meetings with the police. So those meetings were not for media. These are private meetings he was going to hold with the police director. So we had to proceed to do our work.
Very well. Finally, you talk about the visibility of the police. That seems to be putting the people at ease. But we've also heard that tomato drivers, truck drivers of tomato, traders are being escorted. Is that the only intervention that has been put in place since there are concerns about rampant armed robbery?
Yeah, so they've talked generally about patrols being intensified on the highways. So it's general. And then we are told that some other groups of the anti-robbery teams are in communities as well. But I mean, because it appears that the tomato truck drivers seem to be more of a target for the robbers, what they have said is that definitely the police cannot provide escort for every single tomato truck that wants to travel. But if the tomato traders can come together as a union, and then maybe they can travel in a convoy of a sort, in a group, then an escort, police escort can always be provided for them when they are traveling. So that is the intervention specifically for them. But in terms of the highway robberies in general, what they have done is to intensify patrols generally on the highways.
Albert, thank you very much. Albert Sorry there, who follow the IGP, who is up north, specifically the Upper East region, where he's been touring following concerns about the rampant armed robbery there. Albert will bring us a report subsequently in our bulletins. Now let's look at the issue of road toll increases. Some motorists are asking Minister-designate for Roads and Highways, Kwesi Amoako-Attah, to abandon the idea of increasing road tolls if approved by the appointment committee. They say very little has been done to rehabilitate roads, whilst others describe this as insensitive. That's the decision to increase road tolls amidst the pandemic. It comes after Ms. Amoako-Attah insisted increasing the existing road tolls is the surest way to meet the demand for rehabilitation and maintenance of our roads to improve infrastructure as far as the Ghana's road sector is concerned. Well, are you willing to pay more for the toll? Benjamin Akakbo has been speaking to some of you at the Tema toll booth.
At one of the Accra toll plazas, one of those in Accra. In fact, this particular one connecting Accra Main to Tema. It's one of those on this stretch. Interestingly, I interacted right before this interaction with one of those who actually collect the tolls. I'll leave his name out, but he actually mentioned that on a good day, he can bring in about 1,500 Ghana cedis. There are 3 belts in the day. This morning shift is from 6:30 to 1:30 p.m. There's an afternoon shift and a night shift. So if you multiply 1,500 cedis on a good day by 3, you get 4,500 cedis within a turnover time of 24 hours. Now, there are 8 booths here. So again, if you multiply 4,500 cedis by these 8 toll booths, you get 36,000 cedis on average. Multiply that by a year and you're looking at 13,140,000 Ghana cedis. And that is the reality here at this toll booth. 13,140,000, something to keep in mind. But especially on the back of what the Roads and Highways Minister designate, Kwesi Amoako-Attah, has been saying about increasing tolls in order to maintain, rehabilitate our roads, as well as maybe even construct new ones. We're hitting the streets this morning to interact with some ordinary Ghanaians and find out what they think about that initiative. It's a tricky one because the cars are free-flowing. It's difficult to actually peg down people to speak to them, but we're going to try to do exactly that right now. Do come with me. Your name, please.
Robert.
Robert, now I just want to find out from you. The Roads Minister designate said he will actually increase road tolls. What do you think about that?
I don't think it's not that actually looking at the condition of the economy as of now. I think it should be maintained. Let's keep it like that for some time and let's see how things goes.
Well, he thinks the road tolls should be maintained. And mind you, by the checks I ran right before this discourse, some of the smaller cars, saloon cars, actually pay about 50 pesos. Then there are 4-wheel drives, and maybe those Evans, the trot types, they pay 1 cedi, and of course there are others, much bigger ones, depending on how big they are, their axles and all of that. They pay between 2 cedis and 2 cedis 50 pesewas. So even then, the sum of money in context is different. Let's check out, see whether we can get some others to interact with. Charles, the roads minister is saying that should he get the nod from Parliament, he will increase road tolls. What do you think about that? He is basically saying, Charles is basically saying that he is not in agreement and that it should be maintained. Let's go to the other end and find out whether we can get some people to interact with. All right, so some people not willing to interact with us. Hectic, but let's quickly see whether we can get some others to interact with. The roads minister wants to increase road tolls, the designate. What do you think about that? Do you use this route every day?
Yes, sometimes, but I work in Tema and I live at Bema. So definitely I'll be using these routes henceforth. And I don't think it's right for him to increase because we still have potholes on these routes that every time you have to swerve and probably you might even hit a pedestrian who's walking or who is crossing. Yes.
All right, so for you, there's no reason to increase it?
No, there's no reason because we have to see an improvement on the route before he has to increase there.
What's your name, please?
I'm Ruby.
All right, and that is Ruby, and she is saying from what she sees here and the problems on the roads, she doesn't feel there is any reason at all for the tolls to be increased. At least that is 3 out of 3. All of those we have spoken to this morning are in agreement that the road tolls should not be increased. Do you ply this route often?
Not that often. I only go visiting the port or working on the project at Community 25.
Right. So any increase in these tolls, do you think that would be a problem? That's what the roads minister designate is saying, that there's going to be an increase when he's actually given the nod by Parliament.
What will the increase add to the existing road?
He is saying it will help in rehabilitation and maybe the construction of new roads.
Have they added any figures to it as to how much it's going to cost us and then the increase and then how long will it be? So I think they have to revisit it.
All right. So these are some people that we are interacting with and they have been sharing their thoughts. So far, it is 4 or 5, all of them saying they don't want any increase in the tolls. And in fact, the very last person I interacted with said that he is not even seeing, the last 2 people I spoke to, they are saying they don't even see what the sums collected here are used for. And so for what reason would they have to pay more?
Well, Benjamin Akakbo there, will you want to pay more? I'm not sure what the answer is, but away from that, green at a traffic intersection does not always mean go, as learned in the popular nursery rhyme. This is because a green at a malfunctioning traffic light could actually mean green for vehicles moving in all directions, as has been happening at the traffic intersection here near Joy FM. The malfunction, which is yet to be resolved days after it was first reported, is creating chaos and close shaves, which residents and road users say could soon result in an actual crash. Judith Awachitando, who first reported on the malfunctioning Sadisco traffic light, has returned to the spot.
It's yet another day here at the Sadisco Junction in Kokomlemle. I was here 2 weeks ago to report on the non-functioning traffic lights in this area. And looking behind me, it's evident that the situation has not changed. One interesting thing to note about this road is that while some traffic lights are non-functioning, others are functioning quite well. This causes drivers to maneuver for right of way on this road. And most of the time, they often clash in the middle of the road. Drivers and regular users of this road are still at high risk of accidents.
Accidents within the past 2 weeks have increased, and so have the frustrations of the people.
Accident
The accidents that occur here beat my imagination. Within just 15 minutes, 3 accidents can occur. One works, one doesn't. And that's what is dangerous, because they give conflicting instructions. A man living in that house right there suffered a terrible accident and broke his legs. When my children are going to school, I get very disturbed.
It's like, especially this traffic light is dangerous. It's like a T-junction. So mostly even we do fight with the drivers. So imagine if you are coming, he will tell you that this line, you can see from this and this, it doesn't show, but only this. So when he's crossing, recently, it seems like 2 weeks or 3 weeks like this, he hit even a policeman. And recently those, the prison service, when they are walking, they deal with protocol, so they don't stay traffic lights. So they do the same thing. They nearly even get accident here. We have an MP here. His office is just closer here, Herring. But still, this light, they are not working towards it.
Until the lights are fixed, it probably may make sense to shut down the lights entirely, as motorists are better off approaching a traffic light that does not work with caution than a traffic light that will only mislead them into crashing into each other. Judith Awotretando for JoyNews.
Well, as we wait for the problem to be fixed, when you get to that junction, you ought to be careful. Now, being a mother of a child with disability can be a burden. But what happens when that mother or caregiver is also suffering from a chronic medical condition and needs special care, even more than the child? In the following report, JoyNews' Beryl Ernestina Richter tells the sad story of a 40-year-old Georgina Yawa Ankra, whose life is fading away due to diabetes.
Jobless and visually impaired, Dokurugu begs on the streets of his hometown, Nalirgu, to put food on the table for his 3 children and wife.
The day that Yana was married, that we vacated from Tripoli, I was attending Tripoli. And then we vacated home and then returned to school again. So I just started. And the vision just decreasing. If I see an object, I'll see the object halfway.
He joined the Association of the Blind and became a beneficiary of the Disability Common Fund.
Producer Beryl to help these people. And now JoyNews' investigations have uncovered persons suspected to have contracted COVID-19 are being held on the same floor as other patients, including pregnant women. This is the VIP ward of the maternity block of the Colibu Teaching Hospital here in Accra. And the reason is, like other hospitals, the places designated for COVID cases are full. Staff won't go on record, but told us they wear the same protective clothing to ward inspections, including the ward with the suspected COVID cases. Kwete Nati reports.
Hospital records show that on the 8th of February 2021, doctors were treating a patient suspected to have contracted COVID-19. The patient was also showing symptoms of fever, difficulty in breathing, and coughing. Clinical notes on another patient with suspected case on admission also read, and I quote, SARS-CoV-2 test to be done. Focal person contacted. He reports they have run out of logistics currently to restock as they take samples as soon as possible. End quote. Another patient with similar COVID-19 symptoms was also admitted into the ward on the 9th of February 2021. On the 5th of February 2021, another patient with symptoms such as severe anemia and pneumonia was also admitted in the same ward. Some staff of the maternity block who spoke to JoyNews under condition of anonymity said the patients were on oxygen when they were brought in.
Well, some came in on oxygen, but now they're a bit better. Oxygen has been discontinued. So currently, their conditions are not so bad that we say, oh, for this patient you're going to use hair. No. But the only problem is we are still waiting for their results.
When JoyNews visited the ward, we observed that the VIP ward has been divided into 2. Patients with suspected cases of COVID-19 are treated at one wing, while the regular ones are at the other end. The staff described this as extremely risky to the patients.
One side, which is the worst, we receive normal cases. In the east is where we have the suspected cases. It is very dangerous. But what can we say?
Hospital staff tell JoyNews what's more dangerous is that they use one protective clothing for all clinical inspections. This is because of inadequate PPE at the maternity block.
The PPEs are not enough, so we are trying to manage. We are just trying to manage, but under normal circumstance, as soon as you enter any room, you should discard whatever you are wearing from head to toe. But when you enter one room, you move to another room with the same PPE.
The staff tell JoyNews they have started taking COVID-19 medication in order to protect themselves as well as their families from contracting the virus.
I'm already on the medications, some of the medications, and I've started treating my kids as well. The whole family, we are on it.
They confirmed to us that transferring such cases to the maternity ward is because the holding bay for isolation is full.
My concern is, at least, they should make us know if really they are using the floor, maternity set floor, as a holding bay. Well, prepare our minds psychologically. Also, if we need training. Training has to be given to us. Under normal circumstances, those caring for the COVID patient, they all undergo special training. And those of us on the floor, we don't have that training. So how are we going to cater for the patients, even if we have PPEs? It can never be done. So I think we need training to cater well for our patients. They are our patients. For that one, we can never say, yeah, we need to take care of them.
Head of Public Relations at the Colibu Teaching Hospital, Mustafa Salifu, has however denied the claims that COVID-19 and non-COVID patients are being kept in the same ward. According to him, their holding bays take one suspected case at a time to prevent the spread of the virus. On claims of inadequate PPEs, Mr. Salifu said the hospital has enough for both staff and patients. Kwetinantis report for JoyNews.
Our Deputy General Secretary of the Ghana Medical Association, Dr. Titus Bayo, has been responding to this expose.
Happening there is not something unusual. At the outset of this pandemic, the Medical Association, we issued a statement encouraging management of various facilities to be innovative on how to care for the patient. Our understanding of what is happening in Colibu now is that because there are a lot of cases in the capital, the places are getting full in the hospitals, they took a decision at the hospital to, and also patients come in with suspicion and they need to take the sample and confirm. The hospital has a center for managing confirmed cases, which is at the fevers unit. Then they have a medical ICU where they can take people who need ICU care. And then within the maternity block, there is a place, an isolation bay for confirmed cases. Now, the decision they took at the department is to make sure that if you are suspected and you have not been confirmed yet, they don't mix you with other patients. So to separate you, they admit you to the 6th floor of the block, which is their VIP ward, where each patient is given their separate room, their washroom, and suite. So they don't mingle with other patients while waiting for your test result. So that if it comes and you are positive, you are either sent to the isolation bay or to the fevers unit where they are managing their confirmed cases. If you are negative, then you are remixed to the patient on the other regular ward. And I think it's a prudent decision by them.
But to the extent that Dr. Bayu, that
yes,
these personnel or the nurses who are supposed to be handling both cases, suspected and non-suspected cases, are not trained to handle COVID cases, because in our interaction with some of them, they tell us that no training whatsoever has been given to them in the handling of the suspected cases, for instance, or COVID cases for that matter.
Yeah, so that was my next step that I was coming to. That is of concern. We expect that by now all workers, healthcare workers, should have had sufficient training to handle COVID cases. And so if the nurses have deficiencies or the healthcare workers that have deficiencies in training, it's something management should look at and address immediately. I am aware that at the beginning they were all taking through how to don and doff PPEs. Maybe people didn't pay a lot of attention because they were not getting cases then. and those are the treatment centers, those who were getting cases then. But I do know that there was training of trainers at the national level, at regional level, and also to be decentralized to every hospital. I think there are some gaps. And so as long as one person feels incapable of taking care of the COVID patient, they need to have retraining. And that thing must be addressed immediately. And I think management must take that very seriously. Reason being that looking at the number of cases that are coming up, we cannot expect that only the treatment centers will be handling cases. Or only the treatment center within Colibu will be handling cases. Almost every hospital now should be prepared to handle a case in one way or the other. So any health worker who is not sufficiently trained should be given the opportunity to be trained well so that they'll be comfortable and confident to handle. The other arm of this is listening to it. I can sense a lot of anxiety among the workers to the extent that some have even started taking the COVID medications or prophylaxis. It's a sign of a lot of anxiety. It's expected that people who are not managing COVID, if they are beginning to manage COVID, this kind of anxiety will come on. But I think, again, management should take a cue from this and find a way of providing some support, psychological support, and adequate training to calm nerves down so that people be comfortable to handle the cases.
One other concern that comes up, because as part of the protocols, we're supposed to treat every suspected case as positive until proving otherwise. But we are told by some of these nurses that they use the same PPE in clinical examination of patients with the suspected COVID cases and other patients as well. Is that the right procedure?
No, that should not be the right procedure. But I should be quick to add that we have different levels of PPE for different levels of care. So I'm sure you people have done documentaries and footages from places like the East Treatment Centers, the medical ICUs. When you go to such places, you have the highest level of PPE to use, which involve the hazmat suit, wearing of the protective cap, the gloves and all of that, and you're using the N95. Now, for a suspected case, per the WHO definition, you don't need that level of PPE. Now, I don't know what type of PPE is being referred to here, but under no circumstance should we be using the same PPE, especially to care for the suspected case and for a patient that is not a suspected case. And then it defeats the purpose, because we do not know, the person may be positive or negative. So if the person becomes positive, what have you done to yourself? What have you done to the other patient? I hear from the report that the hospital PRO said there are enough PPE. If that is the case, then we need to know what type of PPE this is, what is their distribution channels like, what are the supply channels like, and what really is on the ground. That I think the management of the hospital should be able to speak to. But I want to use this to admonish all healthcare workers. You should not expect to be in a level 1 PPE to just manage a suspected case.
Okay.
We basic infection prevention mechanisms that we've all been taught in schools. Let's calm down. Let's not be too anxious, because in the midst of anxiety, we can make mistakes and infect ourselves. And use the appropriate level of PPE for the appropriate level of.
Deputy General Secretary of the Ghana Medical Association, Dr. Titus Bayo there, speaking with MFR Paul last night on the issue. We've been trying to get the management of Colibu Teaching Hospital to respond as well. And when they do that, we'll let you know. Meanwhile, in the meantime, they have denied that this is happening there. This is all the pulse with me, Gifty and up here. Very quick break. We'll be right back. Do stay with us. Welcome back. Let's take a look at the country's COVID-19 situation. I want to take an update from the Ghana Health Service platform. So there you have it. Our new cases, 702. This is as of 13th of February, 702. Those are the new cases we're looking at. But the active cases as we speak, 7,866. So the numbers are obviously coming down there, but it's not the same when it comes to the number of deaths that have been recorded since the pandemic broke. Deaths 561. 561. The number of deaths keep increasing, even though the infection rates or the number of active cases have decreased somewhat. But In total, 77,748 cases have been recorded here in Ghana since March of last year. But this is how it looks like now. Now, the active people, as in the people who are right now living with COVID-19 or are being treated for COVID-19, are 7,866. But unfortunately for us, we've lost 561 of them. Well, it's not all gloomy. If you look at the recoveries there, we have 69,321 out of the 77,748. These people have recovered. Let's keep taking care of ourselves. Subsequently, we'll tell you what the situation is in Germany, which is introducing stricter restrictions. But the Noguchi Memorial Institute has introduced a new system for the processing of samples to ensure efficiency and quick delivery. Director of the Noguchi Institute, Professor Kwabena Bosompem, said the new system introduced cuts off significantly time-consuming processes that have bedeviled them in the past.
Those samples will go to the laboratory, and our people will sit down and take paper and start writing where every sample is going to be. And that itself is taking time. And then when they finish writing it, they will take it to the experimental hood and then put the samples into the plates according to the order. But this time, the machine has done this one for them. So all that they do is to take this sheet and put the samples. And once they have put the samples, the next thing is that they have to go to the PCR machine, which is like this one, and key in A1 is 210211, then A2. Key in each one. That's again taking a lot of time. But this time, this computer is communicating straight to the PCR machine.
The LIS.
Through the LIS, that this is your sample placement. So all that the laboratory technologists or the testing person has to do is to put the plate in the machine. And then it does the analysis. So you can see how much time is cut off. Let's say today in the morning, we'll run the PCRs, let's say around 10 or 11. If you come after 11, your sample will be run in the afternoon batch. Okay. Already that is shifting your frame to almost a day. So it was like 6 to 8 hours, then the results will come. Now with this one, it's going to cut down drastically to maybe 3 to 4 or 5 hours. Okay. So you're taking several hours off. Okay. And if things are running, in batches like that, you end up saving a whole lot over a period. It will be accumulating into thousands of samples.
Well, Dr. Bosompem also says the new system makes it impossible to falsify results, which of course has become an issue since testing began.
Specifically, let's say the turnaround time previously, let's say it's about 8 hours. So you come in the morning, you are tested, and you can get your results maybe in the evening. Now, if you are tested in the morning, you can get your result by midday, that kind of thing. So the effect is huge. And then apart from that, the LIS is also, because of the way it has been automated, it is cutting off all the errors. No more errors, and it's also removing human intervention, and nobody can change the data. The information, if one is tested and the one person is positive or negative, nobody can change it. And even if somebody with higher authority is able to can have an access to change. But when you change it, the computer system records everything you have done, in the sense that that information that is recorded can never be erased. So should there be any issue, if you go in to do any tampering with the data, your ID and your name and everything is recorded against what you did. So anytime that it is cross-checked, it will be there clearly that this person did this at this time. Every record is in the system, and that cannot be deleted. So really, this is one way also that this LIS system is going to more accuracy It is also going to enhance our ability to store the samples, to package the results, ability to retrieve samples, ability to store data and to retrieve the data. So really, it is a comprehensive thing that is adding on to the excellence for testing.
Well, let's go back to the Colibu Teaching Hospital story, where our investigations have uncovered that persons suspected to have contracted COVID-19 are being held at the same floor as other patients, including pregnant women. And that is a VIP ward at the Colibu Teaching Hospital. Mustafa Salifu is the public relations officer for the Colibu Teaching Hospital. Mr. Salifu, good afternoon and thank you for your time.
Good afternoon, Tilly, and good afternoon to your listeners.
So how do authorities explain this situation?
In the first place, we want to state categorical that we are not mixing suspected COVID cases with the negative cases. What is happening is that with the recent surge in numbers of COVID cases, the hospital management decided to use the VIP ward, that is the maternity first floor, to a part of it to hold patients. This is a ward that has individual private rooms with all facilities in there. So the hospital was totally surprised when it was reported that we're mixing suspected COVID cases with non-COVID cases.
So
that is totally untrue.
Now, if you say, Mr. Salifu, if you say that is totally untrue, then we have to break it down a bit more. You have not denied.
What we mean by that is that this is a very big ward, and then about half of the rooms are set aside for suspected COVID cases.
Right.
And what is happening is that even so far, as we put them in these separate individual rooms, even 2 suspected cases are not in one room.
The point that I just wanted to address was that when you say that the report is totally untrue, then it is inaccurate, because it doesn't say that the people are the people are being kept in one room. It says the people are being kept on the same floor. So that is not untrue.
But the maternity block, I don't know whether you understand the architecture of the maternity block.
Help us,
and
I don't.
In so many other areas where they treat COVID cases. What happens is that you may have a whole block, and then divisions are created to hold patients. And that is happening all over the world, not even in Colibu alone.
So you could have a whole block where you have divisions.
Matilda, this is, our people are trained over the years to take care of.
Okay, so Mr. Salifu, just hold on for me. I want to understand this, and I sincerely want to understand this so that my viewers can understand as well. You are giving us a mental picture of this block and how it looks like. You said that this is a whole block, and you could have some kind of partitioning where individuals are kept. Break it down a bit for us. I can't recollect how it looks like. I've been to Colibu, but I can't recollect how it looks like. Help us understand.
Okay, then what I mean by that is that the rooms, first of all, are individual separate rooms. And no one patient stays in the same room with another patient. And then secondly, the ward is a big ward. We have 2 wings to the ward. That is the east wing and then the west wing.
Okay.
The east wing is what we are using to hold these suspected COVID cases. Mind you, they are suspected COVID cases. And what has happened is that so far, all the people who have sent into this holding area, all their test results have returned negative. So let's even say that if they are there, we are saying that no, it's not possible for one patient to transfer, to infect another person or patient within that floor. So
aren't there movements? And I appreciate that this would be a west wing and a right wing, but wouldn't there be interactions between these people in terms of movement? So one patient is moving from one side of the ward or the block to the other. Isn't that something that happens as well, which then puts people in danger of being infected if there are COVID patients on the other side, assuming that these people are positive?
The danger is very, very minimal, if there is any at all. What is happening is that the East Wing has all the facilities that a patient will need. and there wouldn't be the need for the patient to cross to the west wing. So it is rare for somebody to, for a patient to move from the east wing to the west wing. I don't know for whatever reason because these are separate individual rooms that patients are in.
Okay.
And then if for whatever reason they want to go out, we have all the facilities at the east wing that will take care of all their needs. And there are also staff on standby that will help them, so that there wouldn't be the possibility of them crossing to the other side for whatever reason to interact with any other types of patients at the west wing.
What do you make of the fact that personnel at the maternity ward, for example, are using the same PPE in clinical examination of patients with suspected COVID-19 cases?
I think that is one of the erroneous impressions created. What is happening is that when you don your PPE and then you're going to see a suspected case, you don't need to change the entire PPE before you see another patient. As we do in regular cases, you change the glass and you sanitize before you move on to the next patient. And that is what is happening all over. You don't have to see one patient, you go and take off the PPE, don a new set of PPE before you then move on to see another patient. We're all there today. What happens is that as soon as they come out of the place, they will sanitize themselves, remove the gloves and put on new gloves before they move on to see the next patient.
Is that the standard practice, or is this Colibu practice because of lack of PPEs?
If you observe the social distance, if you protect yourself, you put on your nose mask, there wouldn't be the possibility of getting infected by that, because we are all in the room, but because we have all observed the protocols, there is no danger of anybody getting infected.
One of the concerns that have been raised also has to do with the issue of PPEs, the inadequate PPEs for the nurses there. How are authorities dealing with this problem?
The issue of PPE is very important to the hospital. So management is sparing no effort. Management is ready to go to any length to provide PPEs for staff in the hospital. So I was there this morning. I went to their store to see, and then there's evidence that we have adequate PPEs to take care of our patients and staff. Because this is about life and death. And then the hospital will not sit down and then look on for its staff to be exposed.
That sounds very much like the authorities' willingness to do so. Well, the question is whether or not it is being done. Is it? Okay, that's how I understood it.
We have adequate stock, and then we went around and checked, and then it's indeed there. And then all the staff who went around seeing patients were all in the appropriate PPEs to discharge their duties. So we do not have any problem with the PPEs. We have been lucky. We have had philanthropic individuals and corporate organizations coming to our aid to support what government and then the hospital itself are doing to make sure that we have adequate stock of PPEs to take care of.
Does Colibu need help with PPEs when it comes to it?
Government is already giving that support, and then there are philanthropic individuals and corporate organizations that are also coming to support, because they appreciate the hard work and the commitment of our frontline staff. So we'll still encourage them to. The fight is not over, and we are the frontline staff.
Yeah. How difficult has it been? How difficult has it been for the hospital when it comes to case management? Our case management there. How hard is it?
If you can explain.
What are the challenges you face when it comes to managing our cases there?
What are they? I didn't get that question.
What are the challenges you face when it comes to managing COVID cases at Colibu Teaching Hospital?
Initially, yes. Initially, there were challenges because we were all flat-footed. But as the days went by, we are now able to have a handle on it.
Do I get the sense that you don't want to share the challenges with the public?
No, I'm telling you what is happening, because the public is already coming to our aid. And I've mentioned that, yes, we appreciate that, and then we still want them to continue with the support that they are giving us. People are coming with PPEs. People are coming with other resources that we need
to help out
against the COVID-19. And we still want them to continue with that kind of support that they have been giving us.
I appreciate your time, Mr. Salifu. Mustafa Salifu there is the Public Relations Officer for the Colibu Teaching Hospital there. Thank you very much, Mustafa, once again. Now, before we go on to sports, bring you the story about a mother whose child has a disability, but who also has her own chronic disease to deal with. Beryl Richter's report.
My name is Georgina Yawa Ankra. I have 2 children. The last born is 12 years, but I have forgotten the age of the older one. My mother and brothers stayed here with me. They are all dead.
That is Georgina Yawa Ankra struggling to tell me about herself. She lives in one of the poor, densely populated communities in Dome in the Greater Accra region. Yawa claims she was diagnosed with diabetes many years ago. She looks much older than her actual age, her hair falling off strain after strain, every layer of her skin saggy and riddled with wrinkles. The frail-looking woman is unable to do anything for herself. Almost every day, she drags herself to the street to beg for alms.
This is the room Yawa sleeps in. She shares this same room with her teenage daughter, Nyonyo. This room is filled with lots of things, from clothes packed in bags, bowls, basins, which looks untidy, and even cobwebs. This room looks untidy and unkempt. Yawa shares the same room with her daughter. Days when her daughter is not around, it means Yawa has to drag herself on her buttocks to even pick something from the chair or the floor. This is the life Yawa and her daughter have been confronted with for the past 9 years. A life of misery, a life of abject poverty.
Life has been tough for Yawa. Money to access treatment for her condition has been a challenge. She has almost no teeth in her mouth, her tongue weakened with pain that muffles her speech. Yawa has been battered by poverty, and even more so where she lays her head to rest from life's troubles is in a sorry state. Dust, cobwebs, and thick filth have enveloped the room. She appears to have been cut off from her family because of her condition. Grace Damashi is her neighbor who has been here long enough to witness the suffering of the 40-year-old.
Diabetes. I
heard her condition is diabetes, and this has made her crippled. She drags herself to the streets to beg for alms. She was a very beautiful lady and very hardworking, who was also very neat. We, her neighbors, sometimes provide support to her. She does everything in her room, cooks, urinates, and even defecates there.
Yawa's woes have deepened because her second daughter, Nyonyo, lives with Down syndrome. She is unable to provide and care for her teenage daughter because of her helpless state.
The friend was saying,
okay.
What is saying? 6 years.
For a long time, Nyonyo was miserable, lonely, and always looked dirty till a teacher in the neighborhood found her roaming on a school compound.
The first time I saw her, she didn't know how to bath. So for the first year, I was bathing for her every day. But now, when she comes and I'm in class, she would go for the bucket, fetch the water, and then bath for herself. Sometimes, if she's very dirty, then she cannot do it on her own, but she tries. For now, she knows I have to take bucket. She knows where she takes her bath every day. She knows.
The 3 weeks that Greater Accra was placed under lockdown in 2020 to help contain COVID-19 pandemic were the most difficult days of her life. No food, no friends, and no support system.
Because it was a lockdown, I was not visiting. But periodically, I call teachers who live around Domi to check on them for me.
Gloria Sari is a special education officer with the DOM circuit. According to her, Nyonyo's consistent and unkempt appearance to school aroused the curiosity of the teachers to trace the whereabouts of the parents.
We met her one day on the school compound. Lots of children gathered around her, making fun of her. Then I met my sister Lizzie, who also told me she has met a girl like that. She even gave her a bath. So I asked, has the mother noticed it? She said no, she is always around dirty, so I just gave her a bath. I said, if the girl is in school and we are into inclusive education, then let's follow up to the house, find out who the mother is, and let them know that this child can be in school.
That's the story of Yawa. If you're touched to help, you can get in touch with the news team or the producer of the report, which is Beryl. That's the number right there on your screen. Well, this is it for today. There's more news at myjoyonline.com. Do log on. This program is also on demand on our YouTube channel. You can log on and watch this program again. My name is Gifty and I'll appear later tonight with PM Express.